Well, Davin, we have another episode of the Root Cause Business of Medicine podcast. And this was one of my favorite episodes for sure. It was really fun to reconnect with Dr. Samir Qamar. I can never say his name right. Hopefully he'll forgive me. But it was just really fun to reconnect with him. I've known him for a while now and just always admired his entrepreneurial mind, his perspective, and his ambition to change the world of healthcare, and thinking of the little guy out there in that process. What were some of the key takeaways from today's podcast and interview that you had today?
Well, I think what's interesting is, his background was from outside the US, growing up. And so he wasn't like locked into that sort of indoctrinated mindset of our US healthcare system. And obviously he's a super smart guy and very innovative, entrepreneurial, spirit about him. But I think that did maybe help him look at healthcare a little more fresh and say, okay, rather than just saying, hey, where am I going to get a job in the system? He thought there's a better way to do this, and then he found a better way to do it. And it's evolved to the point now where he's, about to launch or has launched a very innovative company that I think will have a big impact on healthcare across the planet.
Yeah. So if you want to know about the future of healthcare and where it's going and who are the influencers in this field, I think you're going to really enjoy today's podcast because Dr. Samir Qamar is just an amazing individual and what he's already accomplished, but now what he is accomplishing in terms of the future of AI and how it's going to assist us in healthcare is just amazing. It's a wonderful discussion. I know you'll enjoy it, and we look forward to having you participate in the podcast. Welcome to the Root Cause Business of Medicine podcast, where we explore what's broken in healthcare and what we can do about it. I'm Dr. Erik Lundquist, and I've been practicing functional medicine for the past 15 to 20 years. I'm excited to co-host this podcast with my brother, Dr. Davin Lundquist,
who's just beginning his journey into functional medicine. We come from different points on the path, but we do share a common goal. We want to rethink how medicine is practiced and help others do the same.
The U.S. healthcare system is in crisis, rising costs, declining outcomes, and physician burnout at an all-time high. But we found a different way, another way, a better way.
On this podcast, we dive into real stories from medical professionals who've stepped away from the traditional model, kind of like me, and have found a new purpose in integrative, functional, and alternative approaches to care.
These are authentic conversations with practitioners and friends who redefine success, not just for themselves, but for their patients and communities.
Whether you're a clinician feeling stuck, a student seeking direction, or just curious about what is possible,
you're in the right place. This is the Root Cause Business of Medicine podcast. Well, welcome to another episode of the Root Cause Business of Medicine podcast. And today, our special guest is my good friend, Samir Qamar. Did I say your name right? I actually didn't ask you how to say your name right, but...
No, that's pronounced Qamar. Qamar is fine. Oh, yeah.
Great. So, Samir Qamar, who I met probably about 16 years ago now. And he was doing a direct primary care program that I was super interested in. We met through a physician who we were hiring, Dr. Narayan, who was with our clinic for almost 10 years. And we got connected that way, and we've kind of been connected ever since. So sometimes a little closer than others, but we've been able to reconnect recently. And I'm super excited to have him share his story today. Because he has a very unique background, and he's got an amazing business and entrepreneurial mind, particularly in the technology world. So I'm going to let Samir actually introduce himself and kind of give us a little background on kind of where you did your medical studies, and then kind of what got you into moving one, we'll call it the three segments that, initially the direct primary care, and then the virtual technology, and then ultimately into AI technology.
Thank you, Erik and Davin, for hosting this. I had a very interesting background. My father was a diplomat for the United Nations. And so we lived in many countries. We were always U.S. citizens, and Dad represented the U.S. for his UN work. And so when you're growing up around the world, you, like a doctor, start to look at human beings as all the same, right? We understand that human beings, regardless of culture, religion, beliefs, are essentially the same biologically in most cases. And that childhood started shaping many decisions that I made as an adult. One of those decisions was, where would I go to medical school? At that time, when I was applying, my parents lived in Italy, where Dad was stationed for 20 years. And to me, my goal was to be a diplomat, like my father. I wanted to have a little flag on my car like he did when he went to go meet dignitaries. And I saw myself being at the WHO at that time, which was a big thing in health. Dad worked for the Food and Agricultural Organization of the UN, which is the UN's largest division. I wanted to work in healthcare. I'd always wanted to be a doctor. So I decided to go to a medical school that was WHO approved because I wanted to come back to the WHO. And that ended up being in the Caribbean. So I actually flew on an airplane from Rome, Italy to Dominica to become a student at Ross University, which was, to me, as a young student, a great decision to be near the beach and so forth. I ended up meeting my wife there as well.
Oh, that's
We're
awesome.
still married today. This is 1995. And the studies at some of the bigger Caribbean schools are such that you do your basic sciences there, and then you end up going elsewhere for your clinical work. I opted to go to England at that time because I'd heard about socialized medicine being a big thing, and I wanted to experience what that was like. So I got to do that, and it was great. We were in England for a year. And then after a year, I thought, I better get some American experience as well. So I came back and did all of my core rotations and electives at Johns Hopkins affiliated places. And that was a lot of fun. When I graduated,
Samir, let me just interrupt you real quick because I'm curious. Yeah. Was that a stark difference in reality in terms of how medicine was practiced? One, what you saw in the Caribbean, when you saw you grew up really never experiencing American healthcare, right? I mean, because you spent a long time in Italy. You go to the Caribbean, you go to England to do your clinical training, and then all of a sudden you show up in the U.S. What was that like?
So, as you may remember, when you were medical students, you're trying to just read and get ahead, take your exams. That's all that really matters. It's in your clinicals that you start to experience being a doctor. So clinicals for me started in the Caribbean. I remember in our second year of medical school, they start having you rotate. I think it was the Princess Margaret Hospital, which was fun. You get to wear a stethoscope, wear a white coat, start feeling like you're almost a doctor now. And if you've ever practiced in a developing country, it is very different. You have limited supplies. You are quite revered amongst the local population because healthcare providers there are very noted as figures in the community. England was very different. England was socialized medicine at its best. Okay, what do you do with a fall? No blood thinners, no head contact. Oh, CT scan of the head. Oh no, we don't do that here. We look at the patient first, get the story, make sure there's symptoms and signs rather that would necessitate such an exam. Really? So that was interesting. You got to practice in a way, or learn how to practice in a way where the physical examination was given a lot of attention. Our physical examination skills were sharpened quite a bit. I remember there was a stroke specialist who could tell which side of the brain the bleed was on by the way they were laying in bed. Things like that were considered magical now, because now it's just get a CT scan. And then we come back to America to practice, and it's CT scan for this, MRI scan for that, blood work, cost is no issue. Well, you find out later it is an issue. Someone pays for that bill. And the training was very different. So there was a big difference in the way medicine was practiced in the Caribbean as a developing country, in England as a socialized medical situation, and then here in the US where everything is privatized. So that opened up my eyes in many ways. And then later I ended up doing my family medicine residency. Well, I did a year of research first at Penn State in HIV, just because I wasn't sure what I wanted to do yet with my career. And I realized one thing: I never wanted to do research again. That was the most boring thing I'd ever done in my life. I was a people person. And so I ended up in family medicine at Lancaster General Hospital, which was the middle of Lancaster, Pennsylvania, Amish country.
Mhm.
And it's where I picked up my bow tie habits for a long time. I've dropped that habit now, and it's where I ended up growing the beard. But that program was inducted into the Penn medicine program, and is considered, as you probably have heard, as one of the better family medicine, more rigorous family medicine programs in the country, because it was an unopposed program. So it was as close as house MD as you could get, where there were only a bunch of residents taking care of all the patients, doing everything in the hospital, from deliveries to traumas to ICU rotations. It was fantastic, that training there. But it was while I was there that I realized I was not going to practice medicine the way it was practiced in the US. And that was then the epiphany that led to concierge medicine.
That's awesome. There's so much from that background. I think you just came in with a different lens, right? You were not exposed to the, and I mean this in a nice way, but the harshness of our medical training. I think in the medical school training, it is extremely fear-based in the United States. And I think that if you ask what any graduating physician's biggest fear is out of medical school, it's getting sued. And it's
Yeah.
and that's not a way. The biggest fear should be that I'm not taking care of my patients well enough, right? It should be that I'm not meeting them in such a way that's going to help transform their lives into a healthier, more optimal state. That should be our biggest fear. And yet we come out of there thinking, I can't make this mistake. I can't make that mistake. I can't, because if I do, I'm going to get sued. And then you get into residency, and I love that term, unopposed, right? Because most of us were in opposing residency programs where you would be, well, what about this? And what about that? Why didn't you do this? And and you failed here and you failed here. And it's just, you come out of there just really, really struggling. I remember even in the middle of medical school, contemplating dropping out. Like, this is not why I went into medicine. And this is, I'm really being fooled. And in my story, it was because I actually went to a conference and listened to a physician who was doing integrated medicine, and he was approaching his patients from a very holistic mindset, where he was looking at their nutrition, looking at their spirituality, offering solutions that were lifestyle based. And I was like, okay, there must be a place for me here at some point in time. I don't know how that road is going to get me there, but it's going to get me there. So after residency, then what did you have this epiphany, but you didn't go back to Italy or England. You stayed here. So what was next then in your journey?
So that's my wife's fault. The reason we didn't go back to Italy, her parents were from California, and that's the end of that. But we'll leave it there. She was born and raised in California. I didn't want to be a burden to my parents. They came from a middle class background. They did very well. But my dad, who I consider a genius, finished his 5-year PhD program at Cornell in just 2 years.
Wow.
And did it on a full scholarship. So I just wasn't raised to have my parents pay for my education. So I funded it myself. I got loans and all that. And I graduated with about $250,000 in loans. And now I'm starting to think, okay, life is about to get real. How much do family doctors get paid when they graduate? And I started looking at the contracts for the graduating seniors, and they were not impressive when you compared them to the contracts that the neurosurgeons and the orthopods were getting. And I'm thinking, okay, my God, this is going to take forever to pay off the loans. And I was always ambitious. My sister at that time was getting her MBA from Penn State. She was living with us while we were in residency. And I would raid her closet when the medical journals would get cumbersome, just to get a new perspective on things. And I really got into learning about how businesses are formed and so forth. And you link that back to my medical loan issues, student loan issues. And I'm thinking there is got to be a better way. So that was one data point for me that just didn't leave me. The second was the way patients were being seen as outpatients. Our residency was, like I said, they made you work hard. And I remember in our first year, they introduced me to my panel of patients who I would follow for 3 years. And it was during my first year as an intern, I was asked to get ready to see my patient panel. I remember looking at that list. It was 13 people on there. I'm like, wow, okay, I've got all day to look at these folks. And they said, no, this is your morning session. What are you talking about? They said, no, this is your morning session. You get an average of about 10 to 15 minutes with each one. And make sure you remember time to dictate, and they have to take vitals. And I did the math in my head, and I'm like, oh my God, this is, how can you, as a family doctor, how can you create that rapport? How can you talk about what is needed from a preventive standpoint? What if they come in with a major concern? And right away, I knew this was the wrong way to practice. And what shocked me was this was the way it was practiced everywhere. It wasn't until residency that I realized that medicine is a business in America, period. And none of us went to school to learn how to file insurance claims. We didn't care about the money side. We're family doctors. If we didn't become family doctors, we would have become monks. We give ourselves, our souls to service. And it was almost considered taboo to ask about salaries or talk about money. And I remember in my very politically liberal program, nobody wanted to talk about salaries, God forbid. I did, because I was this very unshy person who'd grown up around the world and had loans to pay back. So,
wait, you mean you took a realist view to the whole situation?
Yeah, I suppose I did. And that did not make me very popular. But at the end of the intern year, I found out about something strange called concierge medicine. And I looked it up. It was a bizarre term. And I Googled it, because Google was in at that time. This is 2002. And I found a company called MDVIP that had just been launched the year prior. So in my scrubs, I remember I called MDVIP. I was post-call, so I was already pretty loopy, and a little adrenaline, and on coffee and caffeinated. And Darren Engelhardt picked up the phone, and he said, "Hi, this is MDVIP. Can I help you?" And I said, "Yeah, I'm interested in what concierge medicine is." And he explained it to me very nicely. I found out later he was their general counsel, and he says to me, "So, doctor, how many patients do you have?" I said, "Yeah, I've got quite a few. I've got to finish my rounds later on this morning." "Oh, you work in the hospital too. What field?" "Oh, family medicine." Great. "So how many patients do you have on your panel?" I said, "Yeah, I've got to see about 30 patients this morning." "Okay. Well, how many patients in your practice?" And after this good half-hour chat, he realized that I was just a resident and I didn't have my own practice. And I said, "Well, I'm just a resident. I'm an intern." He said, "Oh," and it was funny. His whole mood changed. I said, "Well, we can't help you then, because this is how we work." And he taught me about how they take an established practice and shrink it to a core panel that will pay this membership fee. I said, "Well, Mr. Engelhardt, can you help me when I graduate? I'm going to graduate in 2 years." He said, "No, we don't do that." And so But I was convinced that with a panel of 400 or 500 or 600 patients, I could spend more time with my patients. I could spend time talking to them about their spiritual needs, about their habits, about what made them sick, what made them heal, what made them happy. That's what I was looking for as a family doctor.
Yeah.
And I found it in this industry that was bizarre sounding called concierge medicine. I couldn't find a single attorney to help me start a concierge practice after residency. I even made the front page of the local papers when I announced that this was going to be the future of medicine. Got in trouble for that by my director, actually. He said, you can't say things like that. You can't even prescribe antibiotics out of the hospital yet. I'm like, yeah, I know. But so still have that cover story. And I started advertising my new medical practice while I was a second-year resident around the country to see where I would get the biggest pull. At this time, there was not a single concierge practice in Houston or Chicago. I ended up in Pebble Beach, California, because that's where my best friend from medical school was going. My mother-in-law was happy because I was moving to California finally. And my opening act out of residency was the house physician for Pebble Beach Resorts. And that's a hard act to follow. But that was the beginning of my career. No claims. I billed $2,000 an hour at Pebble Beach, got paid in petty cash, and took care of some very famous people you would know very easily out of Hollywood and worldwide. And that was the start. And I realized that I did not want to practice medicine in that way. I did the math, actually. If I see 25 patients a day, 30 patients a day for 25 years, that means I would have taken care of about 150 to 180,000 patients total in my lifetime. And like the both of you, like every medical student who applies to go to medical school, you don't want to just take care of 150,000 people. You want to save the world. What could I do? And so it started with concierge medicine, and then it trickled to direct primary care, and then that trickled to medical devices, and that trickled to AI, because I wanted to put experience and my very expensive medical education to tech that could scale to millions and not just 150,000 people. Nothing wrong with taking care of a town or a smaller population, but I started getting more ambitious, I suppose, with what I could do with my skill sets that could be scaled to more people. Yeah, it was an interesting end to my residency.
Yeah, no kidding.
Were you, I think we were in medical school kind of at a similar time, the late 90s. I remember, having like a Palm Pilot or something in my pocket, like, do you remember those? Like the
Sure, Palm Pilot, Sony Trio, I had them all.
Hippocrates was the big revelation, right?
Yes. Right. Yeah. So I'm curious, like, were you a tech? Did you gravitate towards tech, or is tech more of like part of the scalable solution, or is it a combination of both?
When you grow up in emerging markets like I did, so I lived in Papua New Guinea for 2.5 years, famous for its headhunters. We had a house built on pillars to avoid the wildlife below. I lived in Jakarta for 2 years. I lived in Kathmandu for 3 years. Places like that. Went to international schools everywhere. Any kind of technology that came from America was cool, right? You could show everybody your BMX bike because everybody's driving these old Chinese bicycles. You could show them your Atari 2600 video game, and now you're the coolest kid on the block because you had Atari. So I was always into tech, I think. Not so much because while you're in medical school, you don't have time for tech. You just, you have to read. You have to keep up with your board exams and all that kind of stuff and take your USMLEs, and that's fine. I got more into it when I was in Silicon Valley. So when I was the house physician for Pebble Beach, you catered to a clientele that would often come down to play golf from Silicon Valley. Many of them were venture capitalists and successful entrepreneurs. And as you might ask, just to make casual conversation, as you do when you're a family doctor, what do you do for a living? And I was always interested in who could afford to pay me $2,000 an hour. And I got some really interesting replies. And many of them were entrepreneurs who had done well selling their companies and going IPO and all of that. And I started getting more and more into tech. MedLion, which was a direct primary care company that I launched after realizing that I could take the membership model, and instead of charging tens of thousands a month, which I did for my concierge practice, I could scale that to more people if I charged less every month and just do primary care. MedLion was the first direct primary care company in California. We opened an office in Mountain View, Silicon Valley, and that got me quite popular with some of the local VCs who now saw a model that could be scaled, maybe with venture capital. So I started meeting with a lot of very famous venture capitalists because they were interested to know. And I was this schmuck, right? I wore a bow tie and a full suit to these venture capital offices. They're looking at me like, oh, great, here's another doctor who thinks he's going to change the healthcare world. And I learned a lot. I was very naive back then. And that's where I started picking up my interest in technology again. And I never went away. So that's where I think it started. I was always interested in technology, but that interest was reignited after I saw what technology could do for the world in Silicon Valley.
Well, I think also, I mean, yeah, you say you were naive, but, your mind was like ahead of the curve, right? I mean, direct primary care, what a great concept. And, it's really taken off, I think, because of the affordable nature, right, of those memberships. So people can have insurance and not feel like they're, whatever they have to pay for that practice. I mean, it's pretty fascinating to me that you were so far ahead of. For me, I just got into this world, a couple of years ago, and my rationale for not taking insurance was just listening to Erik and some of the latest frustrations with what the insurance companies were doing to them, right? Like changing the rules, really squeezing them, making it harder and harder to justify alternative treatments. But aside from a few business magazines or something that you stumbled across, like where did that come from? Where do you think you were able to figure that out at so early in your career?
I don't think it has anything to do with me figuring it out. It was, I grew up in an environment where insurance didn't exist. When Dottore Fabrizio Valente would come visit our family in Rome at our house, he didn't bill insurance. He just stayed and had a cappuccino with us. We went to his wedding. I mean, that's the real family doc thing, right? It's when Dr. Dixit in Kathmandu, the expat doctor who spoke perfect English and was trained in England, when he would come visit us or we would go to his office, we didn't even talk about insurance. Dad didn't have health insurance growing up or working for the UN in those kinds of countries. That was one thing that stuck with me is why is it different here? And fast forward to concierge medicine that we just discussed, it was the provision of primary care in exchange for a membership fee. And that changes the dynamic, as you know, from what is typical in a fee-for-service environment. Because if I have a patient I'm diagnosed with hypertension and I put them on, say, losartan, and I say, okay, Mr. Smith, why don't we see you back in about a month so I can see how this is working? If Mr. Smith is having a problem paying his bills, he's not going to want to pay me for a visit just to know that the medicine is doing its job. If he's not feeling anything, he's not going to come in if he's having trouble paying his bills. And it's not just the monetary cost, right? It's the whole act of getting into your car, taking sick time off of work and coming in. Concierge medicine changed that entire mindset because you could then communicate with the patient by phone, by video, and other ways because there was no fee involved anymore per visit.
Mm-hmm.
And to me, that was cool. I remember when the iPhone came out, I was in Monterey and I had concierge patients texting me and like the doctor does, oh, this is not HIPAA compliant. Just, I don't care, doc. I just want to get you the information so
Yeah.
I don't have to come in. Like, wow, okay. If somebody worth $1 gazillion doesn't care, why should I care? And so you start thinking differently.
Sure.
And I'll never forget, here I am taking care of very wealthy people. I had at least 6 billionaires in my panel. Monterey is a very interesting town. And the recession hit in 2009. My wife was a regular doctor seeing regular patients with insurance and Medicare and so forth. And we had a patient once who called her office, who couldn't come in because he couldn't afford the self-pay rate. He had lost his insurance because of the recession. And I was the one who picked up the phone and I said, so-and-so, you have to come in. He was the editor of a very big paper there. And he said, I can't do it. I can't pay your $100 self-pay rate. And it dawned on me, like, what am I doing? I'm taking care of some very wealthy people here. Why can't we create a membership model for the less fortunate folk, the farm workers in Salinas who'd lost their jobs? So the biggest threat to a concierge practice, by the way, is the way you structured the membership fee. I learned that in residency because nobody would write me a membership fee. And they said, oh, you're providing insurance. You can't do that. I said, no. If MDVIP, a company that's raised venture capital, has done this, there's got to be a way. So if the threat is looking like insurance, it's easy for me. You take what insurance is defined as and you reverse engineer it back into a membership plan that is not defined as insurance. And there's ways to do that, right? You pay after, not in advance. You don't charge for things beyond primary care. There's lots of things you can do. And so I did that. And I knew now how to charge for a membership medical practice without looking like insurance. Why not apply that principle to simply a smaller fee? That's it. And instead of seeing 300 or 400 patients, you would see maybe 1,000. You're still less than the national average, and you'll still make money, probably more money than you would make as an employed doctor. That was the spark for Medline. And I started doing that, and okay, let's do it, see where it goes. And I started doing well. And I'm thinking, okay, this is cool. Then I looked around the country, and I saw there was this company called Q Alliance out of Washington that was doing this with venture capital. And there was Dr. Brian Forrest in North Carolina. I'm like, oh my God, there's other people doing this. This is cool. And then we all collectively became known as the pioneers that did this. So I think it was my upbringing and my unique training that led to this natural progression of what came out to be direct primary care. I always thought that society in America was being brainwashed into thinking healthcare is health insurance. No, it's still that way today. But when I talk, and I'm sure when you talk, you teach people health insurance is not in the business of healthcare. Health insurance is in the business of insurance. And they have done a really good job conditioning the public into thinking that it's healthcare. It is not.
Yeah.
Healthcare is what you and I do in the room when the door closes. So that continued, and it's still that way today. I can't remember the last time I filed an insurance claim. I'm proud of that.
That's awesome. Yeah. And the irony of it is that in reality, what we're being communicated to in terms of using insurance for our healthcare isn't using insurance for healthcare. It's using insurance for sick care. And as long as we can maintain you sick, then from a medical business perspective, we can continue to make money because we have something to build the insurance for. And the inverse of that, in terms of really doing preventative and true healthcare, actually decreases your revenue potential earnings because the patient's healthy now. So they don't have a need to come in and see you. Therefore, you don't generate revenue from caring for that patient, where the direct primary care and concierge models make it such that you are partnering with an individual and you are the expert in the room in terms of how to optimize their health. So they want to go on this journey with you and are willing to pay you money to help you as their mentor, their guide, their physician, their healer, because you're actually helping them from a healthcare perspective than a sick care perspective. And I'll never forget, I had a friend of mine who was a physician not too far from where you were, and he was also taking care of some of the players on the Sacramento Kings. And he calls me up one day because he didn't know about some of the third-party functional medicine testing. He says, "Hey, this player wants to get this gut health test, but he wants to know if his insurance will cover it." And I just thought, like, you got to be kidding me! Like, this is maybe a $200 or $300 test, and he wants to know if his insurance covers it. This is an NBA player. I mean, so to your point, that our society thinks that I need insurance in order to get health care. It was just that was a bit of an epiphany for me to realize, okay, here's somebody with significant financial means, and yet a simple, relatively inexpensive test, he's worried about whether his insurance will pay it or not, in determining whether or not he's going to get the test or not. That was mind-blowing.
That's interesting. I think, and I've had a lot of time to think, like I'm sure you both have had, healthcare versus sick care. I don't think it's entirely the system's fault either. The system's operating exactly as it was designed. It's a health insurance system. It's not a healthcare system, in my opinion.
Yeah.
But I digress. We all have friends who are physicians who decided to go become ICU docs or surgeons. And I think there's a certain mindset with that. They want to be the ones who intervene when things are really bad. We need them. When my dad was in the ICU after his heart attack, he needed a CT surgeon to operate and do the bypass. When he was in the ICU after losing his legs and his hands to gangrene, he needed the ICU doctors there. He was at his worst. And I say prayers for his doctors every day who saved his life, who helped him. But they went into those fields because they wanted to be there when the patient was at their worst. That's their calling. Mm-hmm. We're a little different. We're family doctors. We know and we promote prevention, the healthy lifestyle, the whole body, mind, soul being treated, being strengthened. And I also believe that people in general don't view medicine as a favorable necessity. It's just, do I have to go to the doctor's office? Our waiting rooms are full of people who are sick, dying, they're in pain. These are all negative traits. Who wants to be part of that? Injections, since you're a kid, nobody wants to go to the doc's office. First thing my nieces say is, am I going to get a shot? I'm like, no, don't worry, you're not going to get a shot. I was asked that when I was a kid. It was associated with pain from the very beginning. And so why would you want to go there? Forget the insurance part, just sick care has become this thing where people only will seek services when they're sick, because if they're feeling fine and not feeling pain, they're going to ignore it. That's why hypertension is the silent killer.
Right.
I wish God or whoever you believe in would have put pain receptors in place for hypertension, because then everybody would be coming in for hypertension and prevent strokes that way. But because people only come in when they're feeling bad. I think healthcare is different from medical care, and root cause medicine, functional medicine, whole body approaches, holistic approaches have to do more with healthcare to prevent the need for medical care, if you will. And there is an entire shift, thanks to doctors like yourself, who have put a spotlight on functional medicine, root cause medicine, where people, I believe now, are getting smarter about longevity, about healthcare, about living meaningfully in good health. It's not about just lifespan, it's about health span. And that is good for prevention I believe, and our roles will change as people get more and more aware of these things. Healthcare education was usually guarded by us. Paternalism has always been there in medicine. It's starting to shed itself now, but now people can go to Google, even though 70%, I think the statistics are, regret going to Google because they are all going to have something scary. Now it's AI, which I can get into a little bit. But I believe that the infrastructure has never been the only problem. It's been a lack of distribution of healthcare expertise. People who know, after reading about it, that putting too much salt can eventually kill them earlier in life will probably think twice now about salt. It's education. We get trained. We have no excuse. That's what people pay to see us for. But I think if you were to educate more and more people, then they would be healthier. Yeah, I can go on and on about that, but those are some of my thoughts on healthcare versus sick care.
Well, I think hopefully that leads us into this next phase that we'll hear about, which I think, your new company is probably attempting to solve. I do think that, there's people talk about like, I try to avoid the doctor. I've heard people say that, right? And it's to your point, right? It's because usually people go to the doctor, it's associated with something's wrong. Like, they have a symptom or they're worried that they have something. And so if they can avoid the doctor, that means they're healthy, right? And so I do think that, this narrative is changing, thankfully, that, this idea that there are things you can do to give you more energy, to help you feel better, to be around longer, to enjoy your, kids and grandkids, right? So it's outcome based a little bit more, right? Of people are feeling empowered to say, hey, I need a coach in a way, right? Like if you think about any other aspect of our lives, we turn to mentors, we turn to coaches, we turn to people who can help us become the best version of whatever that is that we're trying to become. And so I love that medicine feels like there's a little bit of a shift, maybe not across the board, but where at least certainly people with means and now even those with less in the direct primary care model can say, hey, I'm going to seek out somebody to help me become even healthier or to have more energy, to live longer. And I think it's an exciting time.
There's been a cultural shift. I've been a physician since 2000, and I've seen that shift, like I'm sure you both have, over the last 10, 15 years. It's in the way doctors are perceived. It's in the way vaccinations are perceived. It's in the way medicines are chemicals, and there's lifestyle and so forth. I think there are many reasons for that. Social media is a big one. Social media crosses borders very easily. People get to see how their counterparts are doing in Denmark or in India, so forth. I think patriotism, which is important, is contradicted by better longevity numbers in other countries like Japan, Italy, Switzerland. Again, social media plays a part. The globalization of humanity with travel, which has increased now, again, because of social media. I keep coming back to social media, I'm realizing that, but I think it's an equalizing field. People start to compare themselves everywhere else now. Not studies that you and I would read about where people live longer in Japan, but regular teenagers and college students are seeing now people in other countries. I read a study yesterday, it was just published in January, that colon cancer now is becoming the number one cause of cancer in people younger than 50. That was unheard of when I was in medical school. Why is that? So you put all this together, and I think now people are actually interested. What can I do now to live longer? Why is America horrible with its infant mortality rate when we have the best tech in the world? Why is our lifespan shorter than, say, a Japanese person's? And they're starting to really wonder and ask good questions about, is it in the water? Literally, is it the minerals? Is it, why do I not feel bloated when I have a pizza and pasta in Italy versus here? What chemicals are in there? Why is so-and-so dye banned in Europe and not here?
Right.
And then you start realizing, again, it's all a business. It's one of the downfalls of a capitalistic society is you start consuming things that help companies make profit. So I can get into that. But I think to go back to the subject at hand, people are getting more aware that there are things they can do now earlier to prevent disease. They look at their own parents. Many newer generations are living with their parents because the economy is now such where they can't afford their own homes and their parents live. My dad lives with me as well. And they're seeing their parents get sick. And what happens, my mom just died of cancer a few months ago. I was witness to that. And then you naturally start thinking about yourself. Okay, well, I'm wired the same way. What's going to happen to me now? What can I do to prevent this or that? And I'm talking about regular people. So I think, and then of course, there's the information superhighway like Google and the internet. You put all that together and you have this perfect storm of people now wanting to take charge of their own health. And I think it's part of the reason why we're seeing this rapid rise in healthcare consumerism a lot. Now you have AI. So one of the things we're doing.
Real quick before you get into that, I think just interjecting, piggybacking on that a little bit, I think COVID also played a big role in this shift,
100%.
right? Because here we had a circumstance where for the first time really created some significant doubt in the medical experts, right? In terms of, are they really guiding us down the right road? Is this really, and again, to your point, people were hearing and seeing what was going on in other countries in terms of how they were using, the medicines that should not be named in terms of prevention, right? Ivermectin and others that were used to help treat and prevent poor outcomes. And we were seeing that they were having much better outcomes than what we were having in the United States. And that information, which would have been kind of kept from us 20 years ago, now, because there's still this mindset in the US, if a study isn't done in the US, it's not worth anything, right? But now, as a population, patients don't care. If it's happening better somewhere else, it doesn't matter if it's India or Jakarta or, Canada even, right? It's like if I'm hearing somebody's getting healthier than I am here, then I'm now questioning the approach that's being given to me. And so I think there was this huge shift that now has started to create that. And now with the increase in technology information, right? The ability of AI to help assess all of that information and collate it into these responses. I think people are now, for the first time, really being choosy about where they get information.
Absolutely. No, I think there is so much information out there that there are those who are unqualified, frankly, who will draw their own conclusions based on experiences and stories. And that gets put out. Misinformation, I think we call it. That can also be dangerous.
Yep.
But at the same time, there are medical standards and authorities globally that agree on a consensus view of a certain medication or a treatment. But I think it's also a reflection of people just simply wanting to get better.
Yeah.
We can't blame them for trying an influencer's recommendation for a certain peptide that may not be available in the US. Do they have that right to try it? I think they do. I'm for freedom of choice. However, I think they should be well informed. It's the same reason we offer informed consent to patients for any major procedure. Socially speaking, that informed consent is still questionable, I believe. But yeah, it's an interesting world we live in now. Very different from where we were, and I think very different from what we're about to become with AI.
Yeah. So how do you think AI then is going to help maybe bridge that gap a little bit, help physicians be better about utilizing um, their book knowledge and their experience knowledge with the ability to coalesce data and information and patterns very quickly? How do you see all of that coming together? I mean, I had a patient who I was meeting with on Wednesday who he's like, I'm sitting there and I'm asking this doctor the question, and he literally turns and says, "Let me ask Chat GTP." And I'm like, "What the heck? I can ask Chat GPT. Like, if you're going to do it, at least hide it from me, right? I don't want to know that you're asking Chat something that I could be asking Chat. I'm not here because I want Chat's opinion. I'm here because I want your opinion. If you don't know, just tell me you don't know and I'll go somewhere else." But, I thought it was an interesting, perspective from a patient standpoint. And I think one of the biggest fears, besides having a malpractice suit for a physician, is not knowing the answer to something, right? I mean, I think if you want to really back a physician into a corner where they're going to come out with their hands up, ready to fight, is when you challenge their knowledge. Like I know more than you about a particular topic, or you ask them a question they don't know the answer. Doctors often will not test for particular labs because they don't know what to do with the results, and that makes us feel very uncomfortable. So how are you like looking at that problem? And I know this is something near and dear to your heart. What are some of the solutions that you guys are now coming up with?
When my mother got cancer 15 years ago, there was a part of her life where she lived with me. That was when my father also had his heart attack and lost his legs and his hands. So they both were living with me for some time. We don't have any kids, but I'm a doctor. My wife's a family doctor. And it just made sense for the parents to be with us because we would always be at their beck and call. We could see if their medicines were okay and help them with their arrangements with specialists and prior auths and whatever they needed. And I got thinking, we can do this because we're tech savvy. We have the medical knowledge. My parents have literally us at their fingertips. What do regular people do? They don't have somebody in the house 24/7 who could answer questions for them. When my father would have heartburn, he'd be worried that it's another heart attack. He could immediately text me and say, "Hey, am I okay?" And I could say, "Yeah, Dad, you're fine." But what do regular people do? And that really bugged me. That was while I was building another tech company called MedWand, which was that's a whole different story. That was a computer mouse that I stuffed medical diagnostics into because I saw a big gap in telemedicine that was growing, which was the lack of physical examinations during video appointments. And I wanted to solve for that, which we did. The company's doing well now, and we got FDA clearance, which is a whole different thing. It's off to the races for that company. But I wanted to see if I could democratize healthcare knowledge that I had that could be accessible by everyone. And around this time is when AI started to creep in. So I have a lot of thoughts about AI, and I've been thinking about it nonstop since that time. But one of my beliefs, going back to that story you gave me, Erik, about your patient, is that AI will change medical practice forever. I truly believe that. I've seen up and just close what AI can do. I keep up with everything because we're building stuff, and we'll get into that in a minute. But AI is not the same AI as it was 2 years ago, which made mistakes, hallucinations, and stuff. If you pay for a model with Anthropic or OpenAI, it's mind-blowing the amount of knowledge that it can hold, but also now it's getting into judgment and reasoning and taste. It's crazy. And I believe that the physicians now who turn to open evidence or other AI models aren't doing a disservice to patients. What they're doing is they're tapping into this vast medical database that will remind them what they need to know to help best take care of the patient. It's not that the doctor doesn't know. It's also about knowing what to ask the AI model to get the best answer. Patients don't know what to ask. the doctor will know better what to ask based on the context with what the patient approached them with. And so that patient shouldn't be unhappy about that, because we simply as doctors can't keep up with the amount of medical knowledge that gets doubled every few months now. When you and I practiced medicine even 20 years ago, it was very different than it is now. Our great-great-grandparents back then, GPs did the surgeries, they did the deliveries, they did everything. That's what they called the general practitioners. But as medical knowledge became more advanced, we needed to branch off into specialties because we just don't know everything about cardiologists. We just can't operate and see patients for a cold at the same time anymore. And so we've already been seeing this branching off of medicine in different places because of how vast the knowledge is getting. And AI now is basically putting all of that together. And I think doctors should use AI now to help them with their decision-making for patients. Now, that said, I believe that we are on, I don't think doctors realize how different their lives are going to become in the next 10 years. And here's what I mean by that. And I don't mean to put any fear or alarm, but I believe that anything cerebral, any role that is cerebral in nature, whether it's analysts or anything where you have to think, is going to be done by AI. And that doesn't mean that our jobs as primary care doctors will go away. What it means is that our roles may change. If a patient walks in and says, "It hurts when I pee, and it burns and I'm going more often," they themselves will tell you they probably have a UTI, either from experience or Googling their symptoms. It doesn't take a doctor who's been trained with 7 years of medical education to tell them that. They know. What they need the doctor for is the prescription. And that is where things may not change right now, but we've just seen a pilot now that's happening in Utah with one of our competitors where AI will even refill your medications. It's supervised in the beginning with a human in the loop, but that will then be left alone to just AI doing it if that pilot works out. That will probably end up becoming a framework for other states in the future and in countries where they don't care about these types of things, like Saudi Arabia or Dubai or China. You're going to start seeing this happen much faster. There's a lot less regulation in those countries. They're willing to take that risk if it means helping more people.
Yeah.
They also harm people sometimes unknowingly or naively, but that's a different thing. So I think AI is going to change the role of doctors. Those roles where we have to do something physical with the patient, surgeries, shots, those things are not going to go anywhere. Those places are not going to go anywhere. But I think a lot of the cerebral things are going to change. So what we're building, and we're not trying to replace doctors. I just want to say that up front. We're not doing that. What we're doing is basically we're building an AI that gives millions, if not billions, of people access to medical reasoning, to healthcare information that's accurate. So we have created an AI agent named Astrid. Astrid actually stands for Assistant to Reinforce Infinite Doctors is what it is. And our goal is to have Astrid become the entity that I was for my parents when they were sick. A place where patients can easily access medical information that's vetted, that doesn't hallucinate, that will give them sources and tell them if a fever for a 2-year-old in the middle of the night is something to worry about or not. AI hallucinates in every domain. It does that, it's getting stronger. But in most domains, the cost is an apology, but in healthcare, that could cost you your life. So we have to make sure that the guardrails are fantastic,
Yeah.
that the instructions are great. I actually designed the prompting system for Astrid as a doctor. I wanted to see if I could get it to ask sequential questions, think in systems, not in question and answer formats, to acknowledge that it does not know the answer to something, to tell you where to go for that answer, to know when to escalate that care to a physician or to a lab or to imaging. So we're working on all of that. And it's going to be a work in progress because AI keeps changing. But our goal is simply this. We're trying to build a tool for billions of people that gives them access through their phone to the best healthcare information. so they can make better decisions and not get sicker. That's what we're building with Astrid. And we're starting with the English language. It's going to be offloaded to the world. We're doing it globally from day one because you can. In traditional healthcare unit economics, you're talking about hiring doctors and building bricks and mortar clinics. But with AI, the only cost you really have to worry about is your compute costs. So the margin to take care of the millionth patient is about the same as the first patient because you don't have physical infrastructure. You can scale borders much faster. Yeah, granted, you have to abide by the regulations of every jurisdiction. Europe has its own. America with HIPAA has its own. Key is to build that in from day one, as doctors are taught, to value privacy, to value security, to value accuracy. And you build something accordingly. Today you have what I consider horizontal AI companies slapping on a healthcare feature because healthcare is a $4 trillion industry they want to tap into. We're the opposite. We're a healthcare company building AI from day one. And I think there's a difference there. That's what we're doing. And we're pretty excited about it. It's already in beta. I should probably get both of you on the list to just play around with it. Phase one is education and information, where you can just ask questions back and forth about symptoms, about healthcare, about nutrition. There's a whole section in there for nutrition, for movement, for sleep, for stress management, because that's the way I believe as a family doctor should report to anyone, anywhere in the world, regardless of where you live. Phase two will be integration, where you'll be able to upload your records, labs, wearable data, and it'll use that information to give you information about what could happen, what should have happened, et cetera. And then lastly, I want to link it up with healthcare services throughout the world where you can get it escalated to doctors, nurses, physicians, labs, all that. So that's happening later. So it's a big project, but I think it's going to be my life's work. I'm tired of startups. I just want to do this now and just get on with this. So I don't have any kids. Here's a selfish reason, right? I don't have any kids. Who's going to take care of me like I took care of mom and dad? Probably no one. So I need Astrid to take care of me when I'm 85 years old and if something happens.
That's right. It's like one of those movies, I, Robot or something, where they have you're creating your own caregiver. I love it. Now it's what an aspirational goal. I think democratizing that kind of healthcare information and advice in a thoughtful way is really, really amazing. I'm a big fan of AI. I think being new to functional and integrative medicine, I think my ability to use that information quicker and advance my sort of transition into the space has been facilitated by AI for sure. And what's been really interesting is seeing people respond, because at the end of the day, that human side of it, right, of feeling like somebody has validated, and heard them and has spent the time to care, to invest in trying to figure out what is going on with them. I don't think they care, that some of that information came, with the help of AI, right? As long as they feel like I'm getting it right.
That's right.
And it's going to help them, right? And that I care. There's that element, and it will be interesting to see how people, without that human piece, how that might unfold, or how people. But that's sort of across the board, not just in medicine, right? As we sort of interact with technology in ways that we didn't expect probably a few decades ago. It'll be interesting to see how we evolve as a species and interact with technology.
I have a lot of love, a lot of respect, a lot of deep admiration for doctors. I am one. My wife is one. But technology waits for no one. And if you think about the reason we went into healthcare what was the end goal here? It's not to simply just have a career, which was part of the goal.
Right.
It was so that humanity could become healthier, whether it was in a small town in South Dakota or a big city in India, doesn't matter. It's human beings trying to get better, trying to live longer, trying to have a better quality of life. And I believe it's a little sad that people now feel the need to have to turn to Google, to AI, to get basic health care information. I think it's because they're desperate.
Yep.
They are willing to forego privacy, HIPAA, any of that, even hallucinations, if it means they can get somewhat of just direction on what to do when they're desperate, because either healthcare is too expensive, it's not affordable, it's too far away, they don't understand. So I think that's where AI can really help bridge that gap. Our roles will change as doctors, but we won't become extinct. It'll just be we'll practice differently.
Yeah.
It's okay.
Well, and I think it's not just the AI piece, right? Because to your point of just that convenience and having an answer when you need it. Just as an example, last night, one of my patients, they sent me a picture of their, child who had a cut, and they're like, ER or not, like that one
Well, they
question,
need to know. That's right.
And to get an answer like right away, like no one wants to go spend 2 hours in the ER, right? Maybe 4, who knows, depending on how busy it is, right? So the confidence that you're making the right decision eases your mind as a person, as a parent. And I think to your point, your experience with your parents at home getting quick answers was the difference between maybe another, ER visit, unnecessary ER visit, and or just that peace of mind, that people deserve. So I think it's really interesting.
It's interesting and it's tricky because I just learned of a new AI doctor startup that was launched out of San Francisco yesterday. Medical students who haven't even yet graduated yet decided to go all in. Good for them for having the courage, but I think unfortunately they would lack the experience of being a physician that all three of us on the call here know is so important. Judgment calls, nutrition, the way you talk to patients even, how to get that rapport. All of us develop our own way, and you don't get that in medical school. You get it through years of experience and seeing patients and holding their hands and all of that. There are other technophiles who are trying to create the AI doctor of the future. And I've always said something, just because you can do something doesn't mean you should. I believe that AI in healthcare needs to be created by doctors, by nurses, by clinicians who understands what it's like to be on both sides of the exam table.
Yeah.
They approach from a strictly consumer perspective because of something that they may have experienced that they weren't in agreement with, or they were wronged, or they want to improve in the system. But I truly believe that healthcare is one of those industries where disruption needs to come from within. All three of us can become patients, but our patients can't become doctors. And unless we know how to tackle and approach innovative healthcare models or technologies from both the clinician's perspective and the consumer's perspective, they're not going to do as well. They're not going to be sustainable. So we're very excited about our launch. It's going to start out in English, and then we're doing Spanish, and then we're doing French, and then Arabic in that order, and then Hindi. But it's voice enabled, so you can speak to it, because there's a lot of people in the world who don't speak English, and many whom are illiterate. They don't know how to text. They can't read or write, so you need to speak to them. So we've done that. And I'm a little nervous about how viral it gets, because it's free initially. It's going to be free, so it can spread quickly, like ChatGPT, but vetted. And there'll be paid plans later for special features and things like that. But it keeps me excited. I can't sleep. I'm so excited thinking that maybe I'll make a difference to somewhere in some village somewhere in the world who will get that information they need about whether or not to go to the doctor 100 miles away or not.
It's amazing. I love it. I think wherever people stand sort of morally or from a philosophical standpoint around how we interact with technology, I think for those of us that have kids, it comes up, should when they were little, should they have a phone in their hands? When should you first let them have a phone?
Yeah.
And I think this is a similar discussion in that, my philosophy, and I'm not saying anyone else's is wrong, but my thought was, this is the world they're growing up in. And, you could just avoid it, or you could teach them how to be at peace with it, right? The sooner they learn how to sort of live with it and understand it and have boundaries and whatnot. And I think in medicine, there's doctors that are almost like trying to avoid it. And I think that's, for me personally, I think that's the wrong approach. I think what you're doing makes a lot of sense. It's the future. And the sooner we learn to coexist in the most meaningful way for patients, I think the better off we'll be.
I totally agree. I think our doctor friends aren't going to have a choice. And it's here because markets are not dictated in healthcare by what the doctors think. They're dictated by what the patients want, what the patients think. We're seeing that with self-ordering of labs, and I want this and I want that. And again, the consumerism of healthcare coming full circle. But it's an exciting world. And, a lot of us in medical school, those in medical school today, they don't have the time to think about technology or business. And I think they should be thinking about both. I also believe that you're going to see a lot more physicians straying away from traditional healthcare to other things, academia, technology, pharma, because doctors can be useful in many ways. The creation of new technologies is a big one. Why can't we scale our knowledge to millions of people? We should be able to do that. We all went to school to serve mankind. And so why not take care of millions? Why only 150,000 if you have that capability? So it's quite fascinating. We have an intern at AstroDoc who had this debate with me about, do I go to medical school? Do I go to business school? Do I become an engineer? And I think I've confused him more than anything because we do all three things at AstroDoc per guide. But I still think there is a very valuable role for the physician, and he'll be going to medical school. And I just told him, combine that with business elements or technology elements, because then you're taking care of yourself and many other people.
Yeah, I love that. And it's been really interesting conversation we've had today, right? I mean, we've been able to really see how your life journey has really shaped you and prepared you for where you are today, and for your capability, as well as your ingenuity, as well as your perspective in terms of how to put together a system that is going to be helpful for the entire world. Not just for those few that you could see at Pebble Beach, right? It was this launched you into the possibilities, but each one of those stepping stones was critical for your development and your perspective to get to where you are today. And I totally agree with you. And I think the one thing that we have talked about with other guests on this podcast, and what you've hinted at to some extent, and that is the part that's never going to really be replaced by AI is the connection, the human connection that we all crave, that we all strive for, that actually makes us stronger and better. And as physicians, I think part of the gift that we've been given and that we foster and develop is this ability to connect with our patients in a way that is inspiring, the way that helps them want to have more of a transformation for health in their lives. And I think that's why they come back. It's why they will maybe sacrifice to pay whatever it is necessary, even when they don't have the means, because they feel that connection and they crave it, and they want to be able to know that, all right, the information that I'm getting off of Google or AI or wherever, you can help me make sense of it, and you can help guide me in my journey and moving forward. So I really, really have enjoyed this conversation with you today. And, normally we end with, okay, well, what do you see the future of medicine to our patient? You've kind of already given us that.
Yeah.
So maybe we'll give you a different question today. Maybe we'll ask you, how do you see the role? We talked about the roles changing, but how do you see the role of maybe role isn't the right word, the partnership between a physician and a patient moving forward, with all of these resources that now we are having developed and are going to be accessible to each of us as time goes on in the next 5 to 10 years?
I think with improved technology, a better equilibrium of healthcare knowledge, AI, doctors are going to end up becoming either coaches or cheerleaders. Patients are going to start wanting to take care of themselves. Thank goodness.
Yep.
They're finally getting it. What you do at 20 matters when you're 80. I'm really happy about that. I hope my nieces will grow up like that, with good habits that will help them when they're older, so they're living longer. But for us as doctors, that role will change. We're not going to become the ones who have to educate them as much as we used to. Patients are going to come in armed with knowledge. And it's new right now, but they shouldn't chastise us if we don't have that same knowledge. We can also look at our AI tools and get the same knowledge very quickly. If they're doing things that are helping themselves and things are going well, we become their cheerleaders. Great job. Keep going. I would add this or that or subtract that, but yeah. Because they don't know how they're doing. They're coming to you with a plan. You can compare them against your other patients and you can tell them that this works. You become your cheerleader. If they're not doing things well, for some reason things aren't working out, we are human. Go work out, do cardio and resistance training 4 times a week. Can't, because I hurt my ankle. I just wish I could, but now I'm getting sedentary. Then they need a coach. And they already are armed with the knowledge. They know what to do. And then we end up coaching them with what to do, what not to do, what to eat, what not to eat. So I think in the end, our primary care role is going to be delegated to coaching or cheerleading, which is kind of what we have always been. You add to that education, and that's what's really taken that 10-minute visit and drawn it out to 15. But that's how I believe we're going to become. Isolation is a torture mechanism. People need human touch to be human. And they will always crave that. I don't think our industry is going to die out where people will seek out a different touch, maybe through psychologists or social workers, maybe an entire new field that I haven't even thought of yet will come into play at some point in the future. But human beings need contact. They need to be built to be around people. I would have much rather had this podcast with both of you in person than on video, if that was possible. It's just the way we are as people. That'll never change. It's cool to see technology and AI and so forth make lives easier for people, but at the end of the day, we are all human, and that will never change.
I love it. That's
Very well said.
That's great. Well, if people want to know more and learn more about Dr. Qamar and Astrid, where should they go?
Yeah, so I know most doctors don't like LinkedIn, but I am very active on LinkedIn. I would recommend, by the way, getting on LinkedIn to stay aware of all these latest developments. Yeah, AstroDoc is like it sounds, ASTRODOC.com. And just go on there and follow what we're doing. And yeah.
That's awesome. Well, thanks for taking the time to be on our podcast today. I think it's been a wonderful, valuable conversation. I know I've enjoyed it, and I'm sure Davin has as well. I can tell just by the smile on his face, which is great. So thank you very much for taking the time, and we look forward to seeing how things evolve.
I'd love that. This was fun. Thank you very much, Erik and Davin.
Yep, you're welcome.